According to the American Heart Association, about every 26 seconds, an American suffers a coronary event. Every 40 seconds, someone in the United States suffers a stroke. Such grim numbers are both alarming and a cause for great concern.
But there are other numbers that may help reassure us.
Built on a world of cardiovascular experience, Lipitor and Caduet, through a combination of Norvasc for high blood pressure and Lipitor for CV benefits, are helping millions get on a course to better cardiovascular health. A wealth of data has demonstrated the benefits of Lipitor. Lipitor is backed by more than 16 years of clinical experience
And has been studied in more than 400 ongoing or completed clinical trials,
including more than 33,000 patients with coronary heart disease and 34,000 patients with hypertension,
more than 15,000 patients with diabetes,
more than 19,000 patients over the age of 65, and more than 16,000 patients at the 80 milligram dose. Over 80,000 patients in all.
Lipitor in Alliance, TNT and CARDS, and Caduet through its Lipitor component in ASCOT LLA offer impressive CV outcomes data.
The Alliance study, an open-label outcomes trial conducted in patients with coronary heart disease enrolled in a managed care or VA setting, assessed whether aggressive LDL-C lowering with Lipitor was superior to usual care, which was defined as any treatment such as diet, behavior modification, or other lipid-lowering therapy, which may have included Lipitor after approval in 1997, deemed appropriate by patients' physicians. With a mean 40.5 milligram dose, Lipitor provided a significant 17% relative risk reduction of primary CV events in the primary endpoint, driven by a significant incremental 47% relative risk reduction in non-fatal MI compared with usual care.
TNT, Treating to New Targets, was an active comparator CV outcomes trial assessing the efficacy and safety of Lipitor 80 milligram versus Lipitor 10 milligram in lowering LDL-C less than 100 milligrams per deciliter in over 10,000 patients with CHD. Lipitor 80 milligram provided a significant incremental 22% relative risk reduction in the primary endpoint of major CV events compared with Lipitor 10 milligram. Congestive heart failure ranks in the top 10 most common causes of hospitalization and the most common cause of hospitalization for patients aged greater than 65 years. In a pre-specified endpoint of TNT, Lipitor 80 milligram provided an overall 26% relative risk reduction in hospitalization for CHF compared with Lipitor 10 milligram in patients with CHD. In the TNT CHF post-hoc analysis of patients with CHD and prior CHF, Lipitor 80 milligram provided a significant 41% relative risk reduction in hospitalization for CHF compared with Lipitor 10 milligram. The majority of new coronary heart disease events occur in patients 65 years and older. An update to AHA08 emphasizes that the results from recent clinical trials provide a strong justification for intensive LDL-C lowering therapy in CVD patients who are over 65 years old. In TNT, in a pre-specified analysis of 3,809 patients over 65 years of age, an 80 milligram dose of Lipitor provided a significant incremental 19% relative risk reduction in major CV events compared with Lipitor 10 milligram.
According to NCEP ATP3 guidelines, diabetes is a CHD risk equivalent. There are 20.8 million patients with diabetes in the U.S. according to the ADA, and patients with type 2 diabetes are at a higher risk of CVD. In patients with type 2 diabetes and one or more additional risk factors but without CHD, the CARD study assessed the effect of Lipitor 10 milligram versus placebo in the prevention of major CV events. In the CARD study, Lipitor 10 milligram provided a significant 37% relative risk reduction in the primary endpoint of major CV events compared with placebo. Compared with placebo, Lipitor 10 mg provided a significant 48% relative risk reduction in stroke. Catuit offers the combined benefits of Lipitor and Norvasc in a single pill. The landmark ASCOT-LLA trial studied more than 10,300 hypertensive patients without clinically evident CHD and greater than or equal to 3 common CV risk factors, taking either Lipitor plus an antihypertensive treatment or placebo plus antihypertensive treatment to assess the benefits of lowering LDL-C in the primary prevention of CHD. ASCOT-LLA was stopped early at 3.3 years upon recommendation of the Data Safety Monitoring Board on the grounds that Lipitor had resulted in a significant reduction in the primary endpoint compared with placebo. In this trial, in patients with hypertension and multiple risk factors, but without coronary heart disease, adding Lipitor to a blood pressure regimen significantly reduced the risk of CV events compared with patients receiving a blood pressure regimen and placebo. BP control was similar in patients in the Lipitor and placebo groups throughout the trial and at study end. Those patients who added Lipitor to a BP regimen in ASCOT-LLA experienced a significant 36% relative risk reduction in the primary endpoint of non-fatal MI and fatal CHD when compared to those taking a BP regimen and placebo. At the 3.3-year termination of ASCOT-LLA, patients in both arms of the trial were offered Lipitor. At the end of another 2.2 years, of those originally assigned Lipitor, 66.7% were taking Lipitor, and of those originally assigned placebo, 62.8% were taking Lipitor. A small percentage of patients in both arms received other statins. A post-hoc analysis was conducted of this 2.2-year follow-up. At the conclusion of the 2.2-year follow-up, the group that was originally assigned to Lipitor during ASCOT-LLA maintained a 36% relative risk reduction in the primary endpoint, compared to those who were originally assigned to placebo.
Remaining adherent to BP and lipid-lowering medications can be a challenge for many patients. In one retrospective cohort study of more than 8,000 managed care patients prescribed separate BP and lipid-lowering medications, 64% were not adherent to both at 6 months. CARPE-P assessed the likelihood of achieving adherence with Catuit versus a variety of 2-pill CCB and statin cohorts in more than 4,700 patients. Based on a retrospective analysis of prescription refill rates among patients taking CCBs and statins, patients taking Catuit were 2 to 3.5 times more likely to be adherent than those taking 2-pill regimens, as seen at 6 and 12 months.
Unlike some other statins, Lipitor provides greater than 50% mean LDL-C reductions, along with a broad range of FDA-approved CV outcomes indications. And Lipitor has an established safety profile with no dose-dependent muscle side effects.
Lipitor has been studied in more than 10 CV outcomes trials, 6 of which have impacted treatment guidelines.
There are still goals to be met.
Lipitor and Catuit are helping meet these goals.
Have a heart-to-heart with your patients about the risks of dyslipidemia or hypertension.
And prescribe Lipitor for your patients with dyslipidemia, or Catuit for your hypertensive patients with dyslipidemia.
For the confidence that a world of experience provides.